Welcome, ladies and gentlemen. Welcome to this Give Me 15 Minutes education program for medical professionals. My name is Jennifer Searfoss, and I am the CEO of the Searfoss Consulting Group. This presentation is covering what you need to know about mobile devices and how they factor into the HIPAA requirements. This is a live session which is being recorded on May 21st, 2013, and will be available for free through iTunes as a podcast or a video archive with handouts on jensearfoss.com. One quick legal note, none of the information contained in this presentation should be construed as legal advice. I encourage you to contact counsel if you have any questions regarding state or federal law that apply to the concepts covered in this session. At the end of the session, I will cover questions that were submitted prior to the live recording. For live participants, feel free to submit your questions at any time in the question box located on your screen. As a side note, this is a presentation that is jointly presented with Searfoss and Associates. It is a Maryland law firm focused on healthcare professionals, and I am a principal with Searfoss and Associates. So with that, let's go ahead and get started. I'm going to cover a number of items here in just this brief 15 minutes. One of them includes what is HIPAA. I'm going to do just a little primer on that, give you a little state of the industry when it comes to mobile devices, and how security is going to figure into that, and also some of the best practices that come out of the HIPAA rules and security requirements. Then this BYOD, bring your own device world, and the considerations you need to take into account, and then what OVERSIGHT has already started with the Department of HHS. So just as a reminder, privacy and security are two different concepts, and they do have two separate rules under the HIPAA guidelines. First, privacy is more of a theory. It is a way of being. It is the concept that I know I need to keep information private. And so it's policies, it is principles, it is training. That is what privacy is. Security are technical and physical mechanisms like a lock, how you are going to keep information private. And when it comes to the mobile device world, we really are focusing on security because definitely people need to know about keeping things private, but because things get lost so frequently in a mobile world, security comes down to the locks and devices you have on it. So again, just a reminder on HIPAA, the privacy rule came out in 2003, the security rule in 2005. It applies to covered entities and business associates in the United States, and this is anyone who is electronically transmitting standardized electronic transactions. You'd know those as the 835, the 837, these standardized claims transactions, and it's for providers, clearinghouses, and health plans. Business associates are also included, so those partners that you work with that are involved in the transmission of that data, they are also held accountable to these rules, especially under the HIPAA mega rule. Protected health information is a very broad definition, and it can include information related to health status, the provision of health care, or the payment of health care. So in many ways, privacy does meet the financial world in this instance because oftentimes we're talking about claims, and that may include things like, honestly, like a Visa or MasterCard number. So it's very important that credit card numbers also be considered as part of your overall protected health information plan. So let's get into the meat of this. Mobile devices obviously include anything all the way from just your handheld phone / smartphone to these new tablets that are out there, all the way from iPad to some of the other tablets that are available, Kindles even if they've been cracked. It includes laptops. It's very broad now. Anything that is a device that can store or transmit data is considered to be relevant under HIPAA. And again, that's really interesting because technically, if you think about it, storage doesn't necessarily mean that it could transmit. Instead, a mobile device could even include like a zip drive. I myself have all my backup on a large portable drive that then once a week goes off-site. So it's one of those, this is a broader definition, and it is definitely something for you to consider the breadth of the definition because it's not just necessarily a phone. One of the interesting things about this, too, is that, again, because they're so portable, the entire device really needs to be addressed. So the device could be, again, that the phone is encrypted. It could be that the zip drive is encrypted. It could mean that your server, again, if it's something that's accessing these mobile devices, has access to it through encryption. That's a really the entity itself, the piece of equipment needs to be encrypted. Those that are accessing it, they also need to be authenticated. And this is, we'll get a little bit more back. So it's not as though you can just encrypt the device. You need to have something else that's going to authenticate the person. And this generally is where passwords come in. There's a number of other things that you can do, but again, passwords are at least the first line of defense. Transmission, again, this is a big issue. So if you think about it, it's not enough to have an encrypted device. So let's say my phone, I am texting someone. So that text itself actually isn't encrypted, so that transmission becomes a problem. Or if I go on a public Wi-Fi, again, it's not, there's no protection for how that transmission is done, and people can grab filters and everything else. So it's a really big deal. And something for you to consider, too, is how do you address that? So again, that's usually where tokens or VPNs or other things come into account. Risk assessment, you need to make sure that mobile devices are included in your, what I recommend is an annual risk assessment. Your policies and procedures need to be broad enough to cover mobile devices, and you need to train people. Oh my goodness, it's amazing how many clinicians and other staff never think of smartphones as being something that is actually covered by HIPAA, but it absolutely is. So a little bit of update on where the industry is today here in 2013 is that because the technology is changing, especially in the healthcare environment, it's not considered a mature area. It is not a technology that is static and things that people can plan for. Instead, really, this is something that there needs to be more work on. Also, 1/3 of patients are accessing medical information on mobile devices. And so this is, again, one of the reasons that it's not necessarily mature is that it really, again, is coming into its own and apps are absolutely in development right now to meet the patient needs. Security is not provided today through one solution. In many ways, I tease that that's more about the user than it is the technology. But also, there are certain technologies that don't necessarily easily permit true encryption. So, for example, and I'm dealing with this today, is that sending through email truly encrypted material requires people to, at the end, download other systems or download other software. And it's amazing how many people are unwilling to download that software. So for me to actually send encrypted information in one of the most secure systems that I'm aware of, guess what? I can't do it because my users aren't able to secure it. So we're going back to some very rudimentary type of things like passwords. Rather annoying, but it's where we're at. The next thing to think about, too, is that it's not just something that clinicians need. Instead, it's something that all of your support staff, so administrators, the CFO, all of these other folks are going to be accessing information that oftentimes, especially let's say that they're looking at a quarterly report of AR, that's going to include information that is considered a protected health information or EPHI. So it's going to be something that needs to be encrypted. So let's talk about those multiple solutions for security. So again, going back to the most rudimentary thing, and in the meaningful use rule for stage 2, they actually said the default is encryption. If you do not have a device or anything encrypted and you're not transmitting information encrypted, you actually have to have a compelling story of why. So right now, device encryption is pretty much expected, and so you need to figure out how you want to do that. But along with that, let's get into some of these others, is user authentication. And usually, again, that's done first through passwords, other tokens. RSA is probably one of them that you might know. But one of the things, too, is that you need to have the double authentication. And this is considered a best practice. They talk a little bit about in the rules, and definitely NIST is a big proponent as they looked at the international standards of doing double authentication. Double authentication is going to be necessarily where you do a password and a token, or let's say you have a device that's already registered and it's only registered for so many users. It's amazing how you can begin to look at double authentication. This is also where biometrics is really coming in, where it has to be like a password that changes and then a thumbprint. Now, the difficulty on double authentication is that physicians do not like this at all. The clinicians are pushing back big time. Storage. So when data is at rest, how are you addressing that? And encryption, again, for data at rest is a really big deal. And so something, again, to think about is how are you going to address that security? So let's say somebody breaks in, and again, everyone should honestly just say that all data is going to be breached. But if it's breached, can it be accessible? And again, encryption offers that opportunity to encrypt it, and if nothing else, to remove the data so that it can't be accessed. And that gets into that remote shutdown and data wipe solutions. So let's say a laptop is lost, it should be encrypted, and then also have a remote shutdown so that you can go in and just completely clean off all the data. Other options are that, again, if it's encrypted and it has a double authentication, that you could actually remove all the keys so that it's rendered impossible to get into. What if, again, going back to that data loss, so you've lost a device and then this quote-unquote possible breach occurs. Right now, again, today, the way that the rules are set up is that if there is any possible opportunity for data to be made available to third parties, it is actually considered a breach, and therefore, if it's more than 500 individuals, you have to report it. It's just the way that the rules are. So do you have an inventory of all devices? Would you know if something is lost or stolen? Do you have physical safeguards, such as locked laptops? This is a really big thing for clinicians that are moving around in a practice or a hospital. The locking of laptops is becoming majorly a big issue. That's why you see the new trays that you can lock them to the tray. But again, that's a really big thing so that you can prevent that theft or loss. And let's say that somebody's like me. I have essentially a beeper on my phone, so I can find it. Because no matter where I am in my house, I will put my phone someplace else. So do you have the radio-enabled locators? It's ITs, I'm low-jacking my phone. Can you low-jack all of your devices? So a lot of things that are available out there to look at the mobile devices and how you want to keep it. Because again, when a mobile device looks at any protected health information, it stores it on the main operating system, and then it also will do it on the SIM card if it was a download. So it becomes a major issue of the data is not just out on the web in the ether. No, it's actually on the device. So devices are being used today. Again, this is from a HIM study that came out late last year. They are being used for the collection of the data at the bedside or just with the patient. Barcode readers are being used to match patients to certain treatments. Monitoring of data, this is a big deal with telemetry, huge, huge aspect. Mobile devices are involved in the monitoring of data, again, live with patients. And then again, to capture visual representation of patient data along with that telemetry. So mobile devices today are, especially in the inpatient setting, are being used all over the place. But the number one thing, again, is that collection of data at the bedside. And if that is true, if that is what is happening, we need to figure out how that data, when it's at rest and when it's being transmitted, is actually going to remain safe and secure. Encryption really is your front line of defense. So quickly, I want to get into bring your own device considerations. One, because people are able to bring their own device to work, and oftentimes they're going to use it. It's what they're familiar with. It's what they like. It's the brand that they choose. They've got their apps set up all in the right way. Because that culture is there, and also because at least if people are like me, they don't have just one device, and they don't just access information from one device. I'm actually at 7 at this point, and 5 of them are mobile. It becomes inventorying more difficult. So it's an interesting thing. Right now, the best practice is saying, you know what, once you gain access, if you are going to access our information, you have to encrypt the device through the company, and that would allow then, when they leave, that you wipe the device. The downside is someone who had that done when I left a recent corporation was that I lost all of my contacts, I lost all my personal messages, I lost everything. So definitely make sure that people understand that and understand the benefit and downside of gaining access. Authentication becomes also an issue with bring your own device. And so again, through that encryption, you can have software policies that actually require more, or at least nothing else, have an app that requires more than just a password, because parents are allowing their kids to do crazy things on their phones. And even my own family, who I love dearly, and they access protected health information from their phones, absolutely, my nephew, he is going to play Where's My Water? So you know what? We understand that. that's why that double authentication needs to happen, because it's not just enough that they know the certain way to get in. They need to have that second way of accessing the data. The way that information is used is less controlled. So for example, let's say off of an EMR PAC system, a clinician downloads an x-ray. Now that that's downloaded, the mobile unit will normally allow them to save that on their own device, or it appears in their downloads. And then they can use that as an attachment and send it out in an unsecured way. So it becomes a really interesting problem of how do you control that. And a lot of it is what is the software that allows them to do this information, because I am aware of many clinicians that choose to text the x-ray or other images to bedside clinicians. So really big issue, but there is apps for that. And again, this is why training is so important, is that people need to understand the rationale of why this matters and what they can do to address that. So just as a side note, beginning this year, we did have our first settlement that happened for a breach of less than 500 individuals. It was for $50,000 to a hospice group in North Idaho. What was interesting about this, again, was, again, laptops are the top thing that get lost all the time. And so there was a presumption that there was a breach because they couldn't show that the laptop was not encrypted. And so, again, that is the default. You need to encrypt all laptops, all devices. That's just step one. But with that, and this is where, again, it gets interesting, is that this group did not have in place policies or procedures to address mobile devices. So they had a security policy, but it didn't really address the fact that, guess what, laptops are moving all over the place, and didn't address the fact that the default is encryption. So again, a settlement, it's a lot cheaper to make solutions up front than a $50,000 settlement. So think about that, again, as you're evaluating how to implement this for your medical group. So with that, again, the top question has always come is, do I really need to address mobile devices? And the simple answer, again, coming out of the OIG OCR settlement from the Hospice Group of North Idaho, is that yes, you do. And it's one, because everybody has laptops, but two, the cultural change of people accessing information from their own devices is just, it's happened. And everyone needs to embrace that. This is a runaway train that you need to get in front of. The beauty is that there's a number of vendors that have some really, really slick solutions that are integrated and intuitive. There will be a consolidation of the technology and the solutions as this area matures, as was pointed out through the HIM survey earlier this year. But again, I really do think that going back to this fundamental is that mobile devices are huge within the HIPAA context. You need to address them, and the first line of defense is encryption solutions. So with that, thank you so much for joining the Give Me 15-minute presentation today on how mobile devices are affected through HIPAA. I hope that you have enjoyed this presentation. To receive notices about upcoming Give Me 15-minute programs, please sign up on gensearfoss.com. Thank you for joining me today for this 15-minute education program. This concludes this presentation.